What happens when sex stops or you don't like it and you're tired of trying? And when sex stops, why is that? And so today I really want to dive into this real conversation. And for starters, I want to welcome, you may know her, that girl from Peacock's Married at First Sight. She's a renowned, insightful, no nonsense clinician. Dr. Pia specializes in guiding individuals and couples through various clinical challenges, and she knows all things relationships, sexuality, and complex trauma. And so today, if this is coming up for you, I just want you to hold space and hold grace for yourself. Know that this is more common than you really think. And this is a time for us to really start working our way back to connection, one small step at a time. Welcome to the Lovers Society. I'm your host, Marissa Nelson, licensed marriage and family therapist, ASEX certified sex therapist, and the therapist to those entrepreneurs and couples all around the world. I've had the awesome responsibility and honor to work with so many couples, especially high achieving couples and women like you who want more from the bedroom and more from life. And so today I really want to dive into this real conversation, the conversation that maybe sometimes we feel scared to say out loud, which is what happens when sex stops or you don't like it and you're tired of trying. Maybe you've been there. I think we've all been there, to be honest. And when sex stops, why is that? And today I really want to perk your curiosity and for us to really unpack when you're reaching for a partner who maybe turns away from you. Or maybe you are disconnected with your own sexuality and your own sense of self. Maybe there's pressure. Maybe you're disconnected, or maybe it's just so painful. And so if you stopped asking for what you need and started wondering, what does this mean for my relationship moving forward? Because underneath it all, as we all see in our therapy room, there could be shame, there could be resentment. And without touch and closeness, many of us feel like we're not chosen or completely done with and over our sex life. And so today, just if this is coming up for you, I just want you to hold space and hold grace for yourself. Know that this is more common than you really think. And this is a time for us to really start working our way back to connection, one small step at a time. And for starters, I want to welcome somebody who is near and dear to my heart. Not only is she my friend, my sweet sore, you may know her, that girl
Hey.
from Peacock's Married at First Sight. She's a renowned, insightful, no nonsense clinician, somebody who is deeply trained in trauma. Dr. Pia specializes in guiding individuals and couples through various clinical challenges, and she knows all things relationships, sexuality, and complex trauma. She's so passionately committed to empowering Black women to balance their inner healing and masterfully with their professional and personal lives. She has over 20 years of experience in mental health, and she is just so inspirational. She's so wonderful. She's so warm. And child, if you hear my friend giggle, it's the cute. If you hear her giggle at her best, she's just
That's
so
true.
fun.
It's high pitch.
No, but it's wonderful and it's joyful and it's infectious. Please welcome Dr. Pia to the Lovers Society. Welcome, friend.
Hey, welcome, welcome. Thank you. What an intro. I don't even know how to follow that up. But yes, thank you. I'm happy to be here. And I'm so proud of you for what you're doing. The people need it.
Well, thank you so much. And I'm so proud of you because you have been gathering edges, on the television
That's what they
for
say.
years. Okay. But the thing is that the reason why I love your approach is this, because I think that sometimes you are direct, you are tactful, but you are loving at the same time.
Yes. Yes.
You see the best in people, and I think that's like a Black mama. I think that's the
Amen. Yes. Yes.
you will gather folks and help them see things in a way that I don't think that they can see things. And at a therapist's best, you are a blind spot mirror. You are
Amen.
not I think the one thing that I really love about your approach is that you really empower couples to see each other and themselves from a different angle.
Yeah, thank you. And I mean, I feel like that's the only way to do
Yeah.
therapy. And I feel like it's innate within me. I mean, yes, I'm this doctor and I'm a therapist and I'm all of these things and have this degree, but at the end of the day, I'm still a human. And
Yeah.
so I think that it's really important to sometimes take the jargon out of things, take sometimes, the book learning, if you will, and make things real, make people feel comfortable. And in doing that, I set the groundwork for defining like respect and trust in the relationship, the therapeutic relationship. And then it allows me to do that getting them together, that directness. Because I feel like a lot of times people come to me and they've had other experiences in therapy before, but they're like, I never talked about this before, or we never went there before. That therapist didn't ask me these types of questions. I asked the typical questions because I'm like, if we're here to do the work, then we got to do the work.
And this is where you and I are very aligned because I do think that the therapeutic relationship, if you feel safe with your therapist, if you feel
Yes.
comfortable with your therapist, in therapy world, it's called joining. But
Yeah.
outside of just joining, just from human to human, just feeling
Hmm.
connected, just knowing
Hmm.
that I feel like I can explore some real uncomfortable stuff. And
Yeah.
you are going to be there for me, and you are not going
Hmm.
to blame or shame me. You're going to hold space for me. And I think that when you're really able to connect and do that with your clients
Hmm.
now have permission to be able to open up. Because let's be
Correct.
honest, all spaces are not safe spaces.
Exactly.
Even
Yeah.
therapists, not all therapists
Absolutely.
are safe. Everybody can do
No.
harm, to be honest,
Yeah.
unintentionally sometimes. I think that
Sure.
even the best and well-meaning therapists can
Mhm.
sometimes unintentionally say something or maybe even make their clients feel uncomfortable. And so when they're able to come to you and you're able to ask those questions, you're able
Mhm.
to help them really dive into their trauma and their sex
Mhm.
lives, which we'll get
Mhm.
into more today.
Yeah.
That's why you're so effective.
Oh, well, thank you. Thank you. And I mean, as you mentioned, you're ASEX certified, sex therapist, ASEX certified, sex educator too, right?
Yeah.
Yeah. You received additional training, right? Like this isn't just part of your average therapist wheelhouse, talking
Like,
about sex or even trauma training, right? Like these are
yeah.
additional things that we go through as therapists. So I think that's another thing that's important to remind the folks is that you need to find someone qualified and competent, to discuss the things that you're going through.
Absolutely. And then also, when does your therapy relationship bump up against your growth? Because especially
Mm.
if you have issues when it comes to sexuality, if you
Mhm.
have concerns that come to your sex life, I do think the average therapist, if they hold space for you, can do a decent enough job. But they don't know how to walk you through. I mean, I'm trying
Yeah.
to be politically
You're
correct,
being really nice. Imma just keep it real. There's a lot of because I'm just saying to you,
Yes.
a lot of therapists they're scared to talk about sex. Absolutely
Yes.
scared.
Yes.
They won't even ask that in a freaking intake. Like that, no matter what you're coming to me for, I ask you about your sexual history. I don't go into
Yes.
my full sex history questionnaire unless you're coming in specifically for that. But a lot of times people are coming in like, oh, I have anxiety. But now all of a sudden I realize you were abused sexually when you were 7 and you never thought that was a big
Yeah.
deal. Do you understand what I'm saying? It's about that Socratic questioning and not being afraid to ask those questions. And when a therapist is not trained in it, they can also feel afraid, right? Or there can be this, maybe they have their own issues with sex. You know what I mean? So you're not getting that full scope unless someone is trained, in my humble opinion.
No, we are aligned. We are aligned. I think that what I mean is more of like they can hold space for you, but they don't know how to walk you through the fire, so to speak.
Gotcha.
They can hold
Gotcha.
space for you, but they don't
Yeah.
know how to walk you through if you've experienced sexual trauma, if you are
Hmm.
going through deep relationship issues that have a huge underpinning around intimacy and sexuality, your own or your partner, that's where you really do need somebody who's specialized to do this work with you. And that
Yeah.
takes me to our full discussion today
Hmm.
because people don't often have permission to talk about sex.
Right.
Just even growing up, I
Hmm.
often talk about coming from a very traditional Caribbean
Hmm.
upbringing where we don't talk about intimacy at all. And
Hmm.
then walking other people through those stories of like shame and guilt, and maybe
Hmm.
you don't talk about sex. Maybe it's
Hmm.
harder to talk about what's going wrong intimately. Now
Yeah.
we get to this stage where you're in a relationship and you want to feel pleasure, you want to have an intimate life with
Hmm.
your partner. and
Mhm.
things are not going according to plan. Things are not
Mhm.
feeling good, things are not connecting, and sometimes that can make sex stop or make us
Mhm.
avoidant towards sexuality. So
Mhm.
I'm curious, Dr. Pia, like what happens if somebody who just says like I'm just tired, I'm over our sex life and they just haven't been
Mhm.
intimate in many years? Like where do you start?
Yeah. Well, I think one, it's important to come from a place of curiosity of why. Why is this happening? When did this start happening? It usually doesn't just happen overnight, right? There's been like lots of things over the course of time that maybe have been overlooked or unexamined or pushed to the side. And so really asking those questions. I think the other part is to like name and validate that there's some burnout, right? Like we're entering the land of like shutting down and stonewalling in a relationship where there's just like maybe there's just been so much conflict that hasn't been resolved, lots of disconnection, like you were speaking about earlier, or failed attempts at repairs or missed bids for connection. And I think it's important to talk about the previous therapeutic experience too, because sometimes I don't know, but I'm sure you've had this experience. They've gone to couples therapy before and it didn't work, or they've seen other therapists and like that didn't work. They read this book and nothing came
That
from
didn't
it.
work.
So it didn't work, right? Like comes this idea of like nothing, this is unfixable, it's hopeless. And so sometimes that means, okay, well, we're just going to live in this dead relationship. We're married, we've got 4 kids, we're not leaving each other. We're just like, we don't need sex or we don't need intimacy. We have these other things that
Mhm.
are important to us. Or they start stepping out of the
Yes.
relationship. Or maybe they're starting to masturbate a lot more and now they can't even biologically get aroused for their partner. Or maybe they're using more porn or doing other things or
They
finding
are
another vice.
compartmentalizing their sexual life away from their partner. It's no longer a shared experience. It is
Yeah.
a solo experience that partners end up having.
Mhm. 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 Yeah.
So when you start to see that, when you start seeing that people are separating and cutting off their sexual life, and not only do they cut off their sexual life, they
Mhm.
cut off helping their partner understand what they need in order for you to be able to come back together. So it becomes, you're not into that. I don't like you don't do this outside of sex. You don't do this as a parent. So sex becomes a place where we critique, but not a place where we can problem solve together. Can you talk a
Right.
little bit about what that looks like as well from the couples that you work with?
Yeah, absolutely. We're really good at naming what we don't like and what we don't want, and not as good at naming what we need or what we desire. And a lot of that comes from, as you were speaking to, just a lack of knowledge. A lot of us weren't brought up openly talking about sex in our families and our life and our, let's not get started on school not doing sex ed. That's a whole other conversation,
That's
right?
a
So we
whole
may not
nother.
have a whole other segment, right?
Yeah.
People lack the verbiage. They lack the verbiage and they lack the safety. And I think that's what's important for me, right? Establishing safety. Sex is one of the most vulnerable positions that we can be in with another person. And so if we don't feel safe, then it's not going to happen. And, sex and intimacy, a lot of people just view that as like the physical act of intercourse or the physical act. And it's so much more than that. It's mental. It is verbal. It is a lot about communication. I always say communication is a lubrication. If we're not talking, we're not effing. Can I cuss on the show? I don't
Go for it.
know. Okay, yeah.
Yeah.
If we're not talking, gotta get. Thank you for the discussion. Yeah, if we're not talking, we're not fucking. You
Ever.
know, ever. It's so important. And a lot of times when people feel uncomfortable, maybe it's coming from a place of shame. Good girls don't do that. Or, my man's
Mhm.
supposed to know how to, make me come. And all of
That's
this, there's this
right.
expectations being placed on the other person because there's this shame or there's this embarrassment or there's just this avoidance piece due to a lack of safety and security and trust.
Absolutely. And then a lot of people will say this because I do think one of the hidden drivers to sexual avoidance and even sexless seasons, whether you're in a sexless season, yes, we're all busy. Yes, there's
Hmm.
burnout. But for some
Yeah.
people, they're like, you had an affair
Mm.
and I'm not over that.
Hmm.
You don't do what you need to do as a partner.
Hmm.
You do not show up as a parent in the way that I need you to. And
Hmm.
therefore, it also feels like intimacy is this place of protection where if we don't
Yeah.
have it, at least I can protect myself. Or
Hmm.
I can shut down my needs because I don't feel emotionally safe with you. I see that a lot. I do see
Yeah.
that a lot, and it drives
Mhm.
an incredible amount of disconnection because what is
Mhm.
not happening outside of the
Mhm.
bedroom is absolutely impacting your ability to
Mhm.
even want to be intimate with your partner.
Absolutely, right? Like you're talking about resentment. Resentment that builds up over
Mhm.
time because of past hurts or current voids, right? Like you're not doing enough around the house or you don't take the kids out enough, right? Like and so then we get into talking about sexual context, right? And I know that you love
Mhm.
Dr. Emily Nagowski's work. She talks about like the accelerators and the brakes, right? Like what turns someone on, what turns someone off. And if there's this mismatch in libido, or if we're not even having that conversation, period, right? Of there's some people in a relationship, yeah, you might have cheated on me. Yeah, this might have happened, but I still sexually desire you on a biological level,
Yeah,
right? And the other partner might say like biologically I can go without sex, I don't need it, right? It's this thing that that other partner needs, and that's when sometimes sex becomes like a reward or a
mhm,
punishment rather than like this is two people who love each other connecting despite what else is going on. And so things get
absolutely.
misunderstood. And so I think that's why it's so important to talk about the accelerators and the brakes, like what turns someone on, small acts of kindness, or, maybe they've showered really well or they're feeling good about their body, or, they just got a raise at work, whatever. And someone else's brakes can be stress from work, the affair, the house isn't clean, whatever it might be. And there can be this mismatch between partners. And they're oftentimes not even having that conversation. So they're just expecting someone to be turned on or expecting the other person to want it. And then it becomes, like you said, like this chore or this like thing they have to do, or it becomes work and the passion is taken out of it, or the idea of like pleasure is just foreign. And so I think it's really important to have those deeper conversations to heal those past hurts, and also to find out what do we need to explore with one another. Do we even want to explore sexually with each other, and what does that look like?
Absolutely. I think the one thing that I hear a lot from clients because they're thinking this, right?
Hmm.
They're
Hmm.
thinking about this, but they are so afraid to talk to their partner about it. And
Yes.
so even though you and I are, we align,
Yes.
sis. We always align. But I will say that one of the challenges that I see is like, but I said this to my partner before, and then there's
Hmm.
underlying feelings of being rejected, or what they're
Hmm.
saying, their partner not receiving what they're saying, their
Yep.
partner not honoring their perspective, or their partner feeling like they are the problem. A
Absolutely.
penny and a dollar for every time I heard somebody
Yeah.
say, listen, my partner has pain during intimacy, my partner has low desire, please just fix them.
Fix them. Fix them, girl.
And then
Yes.
if you just do that, I will be so happy. And it's
Yeah.
like, no, I also am looking at the higher desire partner. I'm looking
Hmm.
at the motivation behind the
Right.
higher desire partner, because I very much also question why we seek out sex to begin with. For some
Mm.
people, it is stress relief.
Yeah.
For
Yeah.
some people, it is reassurance. Like, I'm
Hmm.
asking for sex, particularly if it's been a long time, because I wanna
Right.
know that you still desire me. I wanna know that you
Mhm,
still want me. And by me
mhm,
asking for sex and wanting sex, I
mhm.
am testing and I'm putting it out I'm making bids to see if you
Yeah.
still desire and want me too. And so it
Mhm,
could be also
mhm.
coming from a place of complete insecurity, feeling neglected,
Yeah.
and not knowing
Yeah.
how to reach their partner.
Absolutely, and to add to that, I experience the same things with my couples that I've worked with over the years, and we're talking about fear. There becomes this fear, right, of like that just leads to avoidance, right?
Yeah.
Because the last time I said something to you about it, it didn't go well, or we didn't speak for 3 months, or we didn't, fill in the blank. So if it didn't work before, why am I gonna keep putting myself in this position? So then it just doesn't get talked about, and now, like we talked about before, resentment builds up, and now it's so long that it becomes awkward or uncomfortable. Like, how do you even approach things now? Like, how do we even begin to have this conversation? And it causes trauma, right? Like,
It
if you
does.
have the couple coming in, woman who has dyspareunia or vaginismus and has painful sex, and her partner is saying you're the problem, you just need to go do your work and get fixed. I can't tell you how many times someone comes in by themselves, like, my husband told me I need to be here to fix this,
That's
or
right.
the relationship isn't going to work. Like, my husband said I'm supposed to do this, this, and this, or my wife said, I'm
I
not
have to
lasting
fix
long enough, I have to fix this. Like, it doesn't work that way. We need to both come in,
That's right.
because sex doesn't happen in a vacuum if you're in a relationship. And so it's education too, and not in the sense of school, but like normalizing the issues that are occurring and educating the partner on those issues. So I'm good for like sending some homework, or like, okay, you need to read this, this, and this book, and let's come back and talk about it. Because until it's normalized, again, it's the finger pointing of like, you're the problem.
Absolutely, and not just normalized, but that both partners have ownership in the recovery.
Yes.
that
Yes.
both of you it's
Yes.
required for both of you, not just the person who has lower desire or
Mhm.
the person who experiences pain or the person who has, erectile dysfunction. It is
Mhm.
how do you work together to have a
Mhm.
blended sexual style, but
Mhm.
first, you know, treat it holistically because that
Mhm.
the sexual intercourse aspect of sex is just one part. If you haven't
Absolutely.
been intimate in a long time, it's not just about the sex. It's part of the
Absolutely.
reason, but it's part of a puzzle piece. But the bigger puzzle piece is, are you having the kind of sex that is worth desiring? Are
Mhm.
you in a place with your partner where you can re-image them, or do you feel completely
Mhm.
separated and
Mhm.
disconnected from them? Is
Yeah.
this a self thing where I
Mhm.
feel disconnected from self because my body is changing, or I
Mhm.
don't feel comfortable with my own body?
Yeah.
Have I devalued sex on an
Right.
emotional or faith-based or spiritual level?
Absolutely. Absolutely. And I mean, improving sex oftentimes occurs, maybe I should say almost all the time, occurs outside of the bedroom. People only want to talk about sex when they're having sex or think about it when they're having sex or like associate it with the bed, right? And we're not thinking about the biopsychosocial model. And I'm not trying to get like too clinically, but right. But like when we're talking about like biology, okay,
Yep,
it
we say it here too. It
is
is
my stuff
biopsych.
working? Like, is my stuff working? Are there medications that are, changing my libido or changing my arousal? Am I getting enough sleep? Right? Have I just gone through a significant body change, pregnancy, surgeries, whatever? Psychological. What's my mood like? Have I recently experienced trauma? How much shame am I experiencing? Right. And then the social. What am I receiving? What messages from my culture am I receiving? What messages from like society at large am I receiving? Like what are my relationship dynamics impacting here? And so you're right on. It's much larger than just the physical act. And oftentimes people are disappointed to hear me say that. Like, I don't have this like salacious 5 steps to like better sex that I can just give them, like drop this gym in one
Can I
session.
thank you for saying that? Can I thank you so much for I'm so grateful that you named that because I
Yeah.
think that many times when people come see us, they think that it's a magic bullet.
God,
And
yeah.
they think they're like, "Okay, we're in sex therapy.
Mm-hmm.
Like everything you gonna give me a lube and
Right.
you gonna give me something that's just gonna like I'm just gonna be swinging from every chandelier that
Exactly.
I can find."
Yeah.
Versus, I think that sex therapy, I often look at it as almost like a junk drawer. I have a
Mm.
junk drawer in my kitchen, and it's like
Mm-hmm.
everything is important in there, but you
Yeah.
kinda don't know what's in there.
Yeah.
You don't
Yeah.
know what's in there, so you go through it and you're
Mm-hmm.
like, "Oh, yeah, that's
Right.
important. Oh my gosh, yes, I need
Right.
that." You can't
Right.
get rid of it, but you also don't know what's there, and sometimes that
Mm-hmm.
happens to sexuality, where you don't quite know what are the things that make you tick, what are the
Right.
traumas that are still you're still holding on to, and who you are, past, present, and future, all
Yes.
show up in your sexuality. Your core beliefs, the way that you currently practice intimacy, maybe
Mm-hmm.
the things that have shifted inside of you that you don't
Yeah.
know how to communicate with your partner. And also, let's
Mm-hmm.
be honest, sometimes we're just having the same sex that you've been having for a
Right.
very long time. And so, thinking about getting turned on and aroused for
Mm-hmm.
sex that maybe has outgrown you
Right.
is also something that I think that conversations need to happen,
Mm-hmm.
and it's not a magic bullet.
It definitely isn't, and context is so important, like you're describing, right? We're not the same person we were 15 years ago. We're not the same person before and after baby. We're not the same person before and after, large transitions in life. And it's important to talk about those things and getting the verbiage to talk. Like I said, communication is lubrication. If we're not talking, we're not fucking. If we're not talking, we're not getting aroused. We're not getting excited about this. And desire can shift and change when that's not happening. When discussions are not happening, or when repairs aren't happening. And so it's again about creating that safe space to have these really vital conversations and naming, hey, I don't like this anymore, right? Like that used to turn me on, the first few times we had sex, but now it's 20 years later, like you don't even know what I'm into. And so communicating that to your partner and also having that self-awareness. Talk about how important solo sex is, depending on people's like spiritual and religious beliefs. But your orgasm is your own responsibility. I have to get on people when they expect their partner to get them off, right? Like
Mhm.
if you don't know yourself, how you expect somebody else to know you? Like maybe it was just a one-off that, Tom, Dick, and Harry were able to do it for you. I mean, sometimes it's the novelty of the situation
Yeah.
versus you really understanding your own body and feeling safe and secure to relax and release tension and clenching so that you can achieve orgasm.
Absolutely. But I also think that subconsciously, the reason why is because I do think that intimacy, if a partner knows what you like without sharing it, it
Mhm.
is a subconscious way of being cared for and
Yes.
getting your needs met. And so I
Yes.
think that on a subconscious level, people genuinely want to
Mhm.
be able to feel
Yeah.
cared for, taken care of
Mhm.
by a partner without
Mhm.
having to voice what their needs are,
Mhm.
versus knowing that people can feel empowered sexually, empowered to ask for what you want, empowered to, even create the experience that you would like to see. But it's
Yeah.
hard because a lot of us have been conditioned to think that sex is a performance or sex
Correct.
is in service to
Mhm.
someone
Some
else.
else.
So knowing that,
Mhm.
in
Mhm.
your from your vantage point, what
Mhm.
happens if somebody has not been intimate in a long time? Like, how
Mhm.
would you even bring that up? How do you coach people in bringing that up and it
Mhm.
not feeling like a blame or shame thing? So let's say somebody is ready to
Mhm.
communicate. They're
Mhm.
ready to like start fresh, but they're afraid of how their partner's going to take it or they don't know where to start, especially if it's
Mhm.
been a long time.
Yeah. Well, first, I want to address that fear. Like, why are we afraid to bring it up? And I think that can bring up a whole can of worms of like what is going on that is like the barrier to having these conversations. I think the next thing is like, well, what's the goal, right? Like, if we're having an impasse in therapy, we always say, well, let's bring it back to the goal. Like, why are we here in the first place? Like, what are we trying to achieve? And how do we make that realistic, right? Like, maybe before all types of responsibilities and demands, we had time to have sex all weekend long. Now maybe we have to schedule sex.
Mhm.
So just being realistic about like what are the goals and what are we able to achieve? What are we even striving for? Next, how do we learn what we want ourselves? Because a lot of times people say, like, I want it to be better. I want it to improve. I want to get started again. It's been so long. But like, what does that even look like? I mean, what that looks like for me is different from you, from, the next person and so on. And so it's not this like cookie cutter idea of what sex should be or what intimacy should look like. And so we have to start slow. We have to start with these like micro connections. If the Gottmans talk about like, let's have that 6-second kiss. Let's look into each other's eyes for 2 minutes. Let's spend time laughing with each other. Let's get into, having more dates or having weekly check-ins. And so it starts slow. We have to think of the relationship like a bank account. We have to continue to make deposits into the bank account. Because like we mentioned earlier, sex is usually not just about sex if it's not happening. There's other things going on in the relationship that have not yet been resolved. And so that has to be talked about. So I don't have this easy answer of like, well, we're going to start with this, exercise. People love to come and say like, can you
Oh,
give me some exercises? I mean, yeah, I can, but you're not gonna be very happy with me because how well are they actually going to work? We're putting a Band-Aid over a gunshot wound. I mean, let's
I
just be
love you. You give me so much life because I feel like
yeah.
you're in my brain because it is so a Band-Aid over a gunshot. It is so true because it's deep.
Mhm.
It's systemic work.
Yes.
And so I
Yes.
think that what I want you out there to realize is
Mhm.
that it is totally possible to
Mhm.
completely step into a new chapter of your sexual life
Yeah.
together and even for
Yeah.
yourself because you're having both an individual
Mhm.
process of your own sexuality and you're
Mhm.
also holding space for your partner and your
Yeah.
relationship and how that evolves over time. And
Yeah.
so it's totally possible. But does this mean that maybe you've been in individual therapy for a while or maybe
Mhm.
you've been in couples therapy for a while, but
Mhm.
this is
Mhm.
where the next leg of your healing journey really is because
Mhm.
this is dealing with a lot of your vulnerable emotions, a lot of vulnerable territory, and then
Mhm.
trauma, which takes
Yeah.
me to my next question.
Mhm.
So you and I both see quite a few clients who
Mhm.
experience sexual trauma.
Mhm.
And maybe one of the reasons for their avoidance is that sex is triggering. Sex
Absolutely.
brings up a lot, is loaded for them,
Yeah.
consciously or subconsciously. How do you work and start the work and trauma work with
Mhm.
somebody who wants to be intimate, who has no
Mhm.
problem maybe
Mhm.
with self-pleasure, but
Mhm.
when it comes to sharing intimate space with a partner, especially
Mhm.
since safety is so big in
Mhm. Mhm.
trauma recovery, that's just not connecting for them. Where do you start?
Yeah. I think by naming it and normalizing the act of naming it. I love the book What Happened to You, right?
Yeah.
Because a lot of times partners will say, well, what's wrong with you? Or what's wrong with me? And there's this internalized thinking of like, I need to fix myself or I need to improve or I need to do better. And for me, it's more so about like we have to explore how you got here and taking away that self-blame or taking away that those feelings of shame and really working through that. And a lot of times people don't like that answer because it's not quick work. It's not quick work. Say, yeah, I mean, we can get your relationship, spice it up and do these different things, but how sustainable is that over
Yep.
time? Right? It's not going to be sustainable. So we have to do that hard work first. We have to. It's like when you're cleaning out a wound. Before it gets better, it's going to get worse. It's going to get pussy and nasty, but you have to dig it out. You have to do that
You
cleaning.
have to do it.
You have to do it. And so whether that is talking about the trauma together in a couple session or referring out for individual therapy or doing that own personal work, but I say that it's a personal journey that person has to go on, and it's going to be important for their partner to support them as they're going on it. Because a lot of times people will say, "Well, I can't think about this because my partner doesn't think that's real trauma," or, yeah, everybody has this happen to them, like, that's not such a big deal. Or, I mean, it is what it is, right? This just kind of like it's the avoidance, right? Like overlooking it or minimizing the significance of it. And so I think starting off, it's really important to name that this is happening and to actually name that, yes, it is impacting you. Like you said, whether it's subconscious or conscious, it absolutely is impacting you. And I think because of culture or different reasons, people might say, well, I don't have the time to talk about that. Or, what's the point of it? Like, I can't go back in time. Like, nothing's going to really repair this. And I have to say, well, do you realize the way that it's showing up for you in your relationship? Do you realize why things are so triggering to you or why you maybe have such a short fuse? And like we said, sex is the most like vulnerable and intimate that we can be and close that we can be with another person. So how relaxed can you really be if you have all of these unhealed wounds? And maybe it's that, like you said, it becomes a performance then. I can perform
Ooh,
sexually, right? Or I might think that I need to do all of these things in order to receive love or to be liked or desired by my partner. But am I really getting anything out of that in return? And like pleasure and the idea of sex becomes for that other person versus for
absolutely.
themselves.
Or sometimes people completely dissociate or detach
Yes. Yeah.
sexually
They're not even
because
there.
yeah, because it's easier for them, and that's just the natural defense mechanism
Mhm.
towards any difficult experience. It's just our brain, our survival
Yeah.
brain. And then I also think about how we go into survival mode,
Mhm.
which in
Mhm.
sexuality, you need a relaxed body. You need a
Absolutely.
body that is receptive to touch, that is receptive
Mhm.
to pleasure, that is
Mhm.
present.
Yeah.
If you are still in trauma, then what happens is that the body signals threat. If it signals threat, then we're taking blood flow from our genitals,
Genitals. Yeah.
from our arousal to actually preserve energy. That is survival, and so when that happens, you don't think that it's showing up, but it is. It's
Oh, yeah.
absolutely showing up in more tensed muscles.
Mhm.
Sometimes it can this is where painful sex can
Absolutely.
come into play, particularly if you've experienced vaginismus or you have a
Mhm.
hard time with penetration. This is where
Mhm.
that chronic pain can show up, and then
Mhm.
it's the wiring of, "Oh my gosh, if we have sex again, then is
Mhm.
it gonna hurt? And what is
Right.
that gonna feel?" So then it becomes pretty reflexive. And then
Mhm.
on the other side, I'm also thinking about touch.
Mm. Mhm.
Something as basic, I call touch one of the foundational blocks of intimacy. If you feel unsafe in some ways, you may
Mhm.
not think it's showing up for you, but allowing
Mhm.
somebody to touch you and to be in your
Yes.
space,
Yes.
to make eye contact with you, to really be in close proximity to you, that might feel
Mhm.
really overwhelming. So if that's
Mhm.
something that's coming up for you,
Mhm.
I really want you to think about your own relationship to touch, sexually and otherwise, because what happens inside of the bedroom also shows up. We do not compartmentalize our shit.
Right.
It's it is in
We can't
others.
hide it.
No, yeah, we can't
Yeah.
hide it.
Yeah.
It shows up in other zones too.
Yeah.
But I also am curious about your own
Mhm.
sense of relaxation, how you
Yeah.
normally feel in your body somatically.
Yeah.
And if you notice there's a lot of tension, if you notice you have
Mhm.
back pain or chronic
Mhm.
aches and pain, that could also be a body cue and signal to you that there's just
Mhm.
some things that are unresolved.
Absolutely, and I think that's why sensate focused work is so important and so crucial, and that takes away the pressure from sex is supposed to end in orgasm, or I'm supposed to be this way, like having this it's necessarily like objective. There puts a lot of pressure on sex, and that does not create relaxation. And so if someone's coming in and they're trying to increase desire or trying to overcome trauma or get reacclimated with sex or physical touch, we instruct them to go through sensei focus work, whether that's the full protocol or if it's more like a light version, right? But it's
Yeah.
just the emphasis of temperature, texture, and pressure when touching the body. And not just, touching someone else, but touching yourself, getting comfortable again, like that self exploration. A lot of times people will come in, especially women, and will say, like, I don't touch myself. I don't even know what my vagina looks like. I don't touch myself. I don't like massages, or I don't like this, or I don't like that. And we have to slowly ease them in, because if you're uncomfortable in your own body, you're certainly not going to be comfortable with someone else, touching your body or penetrating you or anything of that nature. And so it can be a slow process to reintroduce someone to self touch and to feeling comfortable enough to allow that partner to be able to engage in touching exercises. And so we'll start off slow with like clothes on. I'll tell people, maybe have on pajamas or have on, just a swimsuit or bathing suit or, bra and underwear, and touch over and avoid the erogenous zones. And just really notice what you feel in your body. Like you said, do that body scan. Notice where you're feeling tension. Notice where you're feeling ticklish. Like that's another thing that, like, if it's too ticklish, so for some people that's good, for some people that's not good. So really having
Mhm.
more body awareness, and then when you're touching your partner, touching for self-exploration, not for their own pleasure. Because that's where we get too much in our heads during sex. And then it's just like you can shut down because you're trying so hard to please the other person or perform in a particular way versus really allowing your body to do its own
Yeah,
thing, right? Like sex is a
absolutely.
natural thing. We are going to naturally orgasm if the circumstances are right. It's like breathing, right? You don't have to try to breathe, happens organically.
I love that you say that because
Yeah.
the word of the day to me is pressure free. And I think that
Mhm.
that's one of the reasons why sex goes for a long period of time. Yes, you
Mhm.
have resentments, possibly you have relationship and conflict repair
Yeah.
concerns, but also on the other side of that, sometimes people just feel pressure. And when
Yeah.
you feel pressure to perform, pressure that you're going to disappoint your partner or let your partner down, or pressure
Yeah.
that sex needs to be this thing because we haven't had it in a while. And so, like,
Mhm.
I don't want it to feel awkward. I don't want to be awkward. It's like,
Yeah.
how do we lean into that and just allow ourselves to work through it and troubleshoot
Mhm.
it,
Mhm.
as opposed to making sex this very loaded, pressure filled
Yeah. Yeah.
activity that, of
Mhm.
course, if it feels so loaded,
Mhm.
people are going to want to avoid things that make them feel super uncomfortable.
Absolutely. And I think that's taking it back to establishing a sense of safety, right? Like
Hmm.
we don't want to do things if we feel like our partner's going to judge us or laugh at
Right.
us or if we have our own, like, insecurities. So establishing what do I need to improve safety and trust in the relationship? And sometimes that takes a long time to figure those things out. And sometimes that's also trial and error, but it's about being open and vulnerable. But you can't be open and vulnerable if you don't have
If
the
you can't.
safety and trust. Yeah.
Absolutely, and you can ask too, what does safety and trust look like outside of the bedroom in our partnership? And also, what does it look like sexually? Because those could be two different values or they could be very aligned. Maybe
Hmm.
sexually, you want, in order for you to feel safe, you want to feel comfortable to bring humor or to have play. You want to, you don't want any judgment. You want to be able to really connect
Hmm.
emotionally,
Hmm.
and be present. Whatever those values are for you, those are
Yeah.
things that you can also share. And you can, that's a great place to start. If you
Yeah.
haven't been intimate in a while, because safety and trust is really the foundation of
Hmm.
trying again, it allows us to be vulnerable when you do have safety and trust.
Hmm.
Then that can really be a great conversation to lean into to say, these are the things that I might need to show up better, or to show it's not even about better, but to really show up and really feel comfortable enough
Hmm.
to share intimacy with you again.
Hmm. Yeah, absolutely. And, it makes me think about not only just establishing safety and trust, but like attunement, right? Like
Yes,
how much can we
yes,
attune to our partner? How, like you mentioned earlier, I don't forget how you phrased it, but something along the lines of like, it feels really good to have a partner that just knows your body or like knows how to, make love to you or however,
yes,
however you phrased it, right? Like
yes.
it means that that person is really paying attention to your
Tension.
nonverbal cues and they're really attuned and turning into and turning toward you. And that happens when there's a sense of safety and security. This is probably a whole other conversation another time, but the impact of attachment styles are so important,
Yes.
right? Like, how were we raised? How were we brought up to feel secure in a relationship versus if we're feeling anxious or if we feel, avoidant, if we feel insecure within a relationship? We may not be so able to attune, or we may be hyper attuned so much so that we lose sight
Yeah.
of ourselves and what we
Yeah.
need and what we want. So it's very, very layered. And I don't say that as a way to like deter people of like, oh my gosh, this sounds like so much work and it's never going to change and, feed into hopelessness, but more so of how do we overcome anxiety by naming it, by approaching it instead of avoiding it. And so when we name the issues that are going on, we do that, if you're coming in for sex therapy, if we do that, really thorough sexual history intake and we understand and we name what's going on, we can begin to pull apart those issues that kind of like layer by layer, like an onion, right? Like that's what we think about with trauma. We have to pull it back layer by layer, a slow, slow process. But in the time of doing that, the connection improves in the relationship. And like I said, it's those micro repairs, it's those that have to happen over time.
Absolutely. And I agree with you so much because when you look at attachment styles, you can see how people trigger each other and just the avoidance in
Oh
and of
yeah.
itself, triggering this person doesn't love me, this person's not attractive to me. What if
Mm-hmm.
I lost more weight? What if I did
Yeah.
this? And you can
Yeah.
start to hear some of that mental chatter come up emotionally for you
Mm-hmm.
when rejection or avoidance happens. And so
Mm-hmm.
if you start to understand your history together, then you
Mm-hmm.
can say, okay, I I I think for some couples, I get it, but now what? I
Right.
hear that question a lot. Okay, well, I understand it. We've been in couple therapy, or I get it, and I know that that's what's happening for that person. Now
Mm-hmm.
what? The now what is if you know and are empowered with that information when things show up, you can
Mm-hmm.
have conversations and you can
Mm-hmm.
troubleshoot things in real time
Yes.
versus taking it personally,
Mm-hmm.
ingesting it and making it mean something about you that then triggers your partner that then starts
Yes.
like whole domino effect versus
Yes.
like, listen, honey, I see where things are at. I feel
Mm-hmm.
like this is happening for you. What do you need right now? How can
Mm-hmm.
I support you right now? This is what's
Mm-hmm.
coming up for me. This
Mm-hmm.
is what I may need right now. This is what I
Yeah.
got wrong. Can you
Mm-hmm.
forgive me for that? And to really be able to work through things together as opposed to saying, nope, lock it up. It's much
Yeah.
easier not to talk about it, not to touch it.
Yeah. Yep.
It's
Yeah.
much easier for some people to do that. And we want to empower you to lean in because you,
Mhm.
you can totally do it. It's doable.
It is doable, and that empowerment can come in education, and, like, that's when like, after we've set the foundation, we've done all the work that we've been talking about thus far, that's where the skills come in, after you've created that groundwork, because a lot of times people come in, they don't know how to talk to each other, right? They
Mm-mm.
don't know how to make repairs after a big blow up. They don't know how to ask for things in a way that their partner is going to receive it, and again, it's not a cookie cutter thing, and I can't just say, like, "Try these 5 things." It is really a matter of how is that gonna work for your partner, right? And asking those questions. And if you don't know what questions to ask, then where are you going to go? Right. So if
Yeah.
and now what? That means, well, now we have to get somebody else or we have to, get some books and read about this. We could take an online course, do something to educate ourselves. So those skills that we are lacking, we can feel more confident if we have, educated ourselves.
Absolutely. And that you are both aligned in wanting to work through this together, that this
Got to
is
be
not just
committed.
one person's issue. This
Yeah.
is not just something that you're going to snap your fingers and we're just going to, the expectation is that sex should happen immediately. It
Hmm.
is really being locked in on
Hmm.
expanding your love, your connection, the way that you
Yeah.
touch, and the way that you approach intimacy, because that's
Hmm.
really what it's all about.
Yeah.
Thank you, Dr. P. You're amazing. Did I?
Thank
I mean,
you.
I always
You're
knew
amazing.
that, but I mean, yeah. I always knew that, but it's just so wonderful to hear your perspective. I mean, we've talked about our clinical work, but especially
Yeah.
when it comes to sex therapy, it is so
Yeah.
nuanced. And
It
even
is.
though we see patterns, like everybody's situation is so different, and it still
Mhm.
requires the same thing for you to look at things biopsychosocial. So if you haven't been intimate in a while, biology, we might want to make
Yeah.
our annual appointments with
Yeah.
practitioners to see if I'm experiencing pain, is it a pelvic floor issue? Is it
Mhm.
hormonal for me because I'm
Oh, yeah.
perimenopause or
Mhm.
postpartum? or
Mhm.
I'm feeling like I'm getting dryness during sex, or it's
Yeah.
not feeling the way that I would like it to feel. Are
Mhm.
you dealing post a medical condition
Yeah.
where sex does have to feel more gentle, or you do have to
Mhm.
redefine what intimacy means for you after a hysterectomy or,
Yeah.
fibroid surgery? I'm also
Mhm.
thinking about you when, you know, seasons change and
Yeah.
maybe emotionally you are
Mhm.
exhausted at work
Yeah.
and you're traveling, you might be traveling a lot. The kids might need something. You might just be stretched really thin because we have a lot
Mhm.
of clients that are caregivers and
Oh,
parents.
yeah. Yeah. And I mean, to add to that, if you're going through grief, right?
If you're
Like,
going through grief, yeah,
all these life transitions, things change. And the same for, men as well, going to get
yeah,
checked, going to that urologist, right? Like,
going to a urologist
are we experiencing erectile dysfunction? Do we need to, do some work in that area?
or low T, yeah, low
Yeah, low
testosterone.
testosterone, absolutely, like getting your levels checked. These are things that are all really important because we do have to, the first thing that we talk about in sex therapy is we have to rule out a medical condition underlying any of this. So there's, like I said, a lot of groundwork that happens before like the fun tips and tricks that seem so salacious and fun, like on these people's internets that
On
they
these
just, they,
who they must be your friends because 'cause they're not my friends.
friends. This is, there's all these like latest like TikTok
Yes.
trends and this and that. And I know I probably sound like an old person, but that's part of the reason why I don't know how I feel about being this like internet person or being on somebody's television because I don't have these like little do these 5 things or do this because there's no quick answer. I don't truly believe or operate that there's this quick way to resolve these issues because they've been
That's
long
what separates
standing.
you from the rest, and I think that's what separates practitioners from others because we are, I think both of us in our fields, like,
Mm-hmm.
we are committed to
Yeah.
making sure that you are healed holistically.
Correct.
A tip can
Yeah.
help you. I'm
Yeah.
never gonna, a tip can help you, but
Mm-hmm.
what you need, particularly if you're dealing with complex trauma or
Yes.
complex issues as it relates to your sex life, it's not gonna be a one size fits
Mm-mm.
all approach. It's
No.
gonna be some personal development. It's gonna be
Mhm.
education. It's gonna be
Mhm.
sometimes med management. If you're
Mhm.
on any SSRIs for depression or anxiety or
Mhm.
otherwise, that also affects libido.
Yeah.
And so you might wanna look at that. If you're going through any hormonal changes, that also affects. If you're dealing with stress and trauma, or even if you have high blood pressure, diabetes, that affects blood flow, which also
Absolutely.
affects a sexual functioning.
Yeah.
That's gonna take me to our segment, Calling All Lovers. This is a segment where a listener writes into us and they usually have a relationship concern that they can use our support about. And so I thought you would be perfect for this, Dr. Pia.
Well, thank you. I love that you have listeners writing in. Look at you.
Yes. Yes. All right. So here's the letter that I got. It's called She says, "It's been almost 3 years since my husband and I were intimate. After his affair, I shut down completely. Between raising kids, holding everything together, and pretending we're fine, I just can't go there.
Mm.
Recently, we've just started having sex again, but it doesn't feel right. Um, I don't feel connected, and honestly, I'm just not satisfied. I keep wondering if this is what's supposed to be right now, and if it's okay that it doesn't feel good yet." I wanna start
Sis,
with
I hate
you.
this. I hate this for you. 3 years, it sounds like very unfulfilled. So, like we kind of talked about before, it sucks when there's been infidelity or there's been some sort of large hurt because that emotional connection sounds like it's dying off. And it's going to be hard to have a desire for physical connection. And so I wonder if this person is in individual therapy or even in couples therapy to heal from that hurt. I know that you got the pleasure of working with and meeting infamous Esther Perel.
By definition, if you don't believe that you are worthy or deserving of love, unconsciously you would put yourself in a situation for which you would feel guilty for wanting what you want.
Ah, that's very smart.
Esther.
Esther Perel. And so, she talks about in the state of affairs that, we can't hold this over someone's head forever and ever. That if we're going to address this, and it sounds like this is what needs to be done, is we need to maybe take some time and say, okay, this is the time where we're going to ask all the questions that we're going to be the investigator to find out, what happened. And then we're going to leave it from there. We're not going to talk about this every other time. There has to be some sort of resolution, and there has to be a discussion of, well, what do I need from my partner to heal from this? And is that a realistic ask? Right. And so I think until that wound is healed, we're not going to have sexual desire
Because
for that
the
partner.
elements that you talked about and that we talked about, the safety, the trust,
Yeah.
the connection,
All of that.
those are compromised.
Right. And I mean, you talk about dissociation. Is that person thinking about, like, well, how did he do it with her? Or what did she look like? Or, am I as good at, like, there's all this comparison that then
Yeah.
happens. And so you're in your head. And so that has to be resolved. And we have to slow walk it to reestablish that trust, to reestablish that desire. And so this might be a situation of, doing some sensate work, exploring sexual touch, and doing some solo sex. I wonder if this person's not had sex with their partner for 3 years. Are they having sex with themselves? Are they even aware of what turns them on, what turns them off? Are they aware of changes in their libido? Where have they been satisfying that need elsewhere? Or has it just been, gone unmet, so that now we're looking at all of this resentment that's built up? So I wish I had an easier answer of, how do we slowly get back into sex after 3 years? I think it's going to take a lot of talking first.
Absolutely. And I think the other thing that comes to mind is a little soul searching too.
Yeah.
Because it kind of feels too, you do not want to feel like a bystander in your own sexual life
Yeah.
or in your own relationship either.
I love that bystander. Yeah.
You don't want to feel like the things are happening to you. And
Mm-hmm.
so I wonder what it looks like as well. What does ownership of this look like? Because I think so
Mm-hmm.
many people feel so stuck. And I get
Yeah.
it. I mean, the inner conflict and the dilemma when we see
Mm-hmm.
affairs is people who are desperately upset and
Yes.
sad, but then genuinely love their partner, love the
Yes.
life that they've built together,
Yes.
love the
Yes.
kids and the in-laws and all of this stuff. And it feels far
Yeah.
too great to leave even
Mhm.
if you're unsatisfied. But
Yeah.
I get it. I understand the inner dilemma and the conflict. I think on
Yeah.
the other side of that, what is your sexual dilemma?
Mhm.
Is this a place where your resentment is playing out, where you
Yeah.
feel like the way that you've coped with things was just to detach,
Mhm.
emotionally? So even though
Yeah.
sex is happening, that
Yeah.
this is another aspect of self that is
Mhm.
detached from your partner, but kind of
Yes.
going through the motions. Sometimes
Yes.
I think they can be symbolic
Yeah.
of some greater themes that are happening. So I hold space for you and for anybody else out there who has experienced this as well. I hold
Mhm.
space for the journey because it will be one and it doesn't happen overnight. But I'm curious about you. I think for a long time, I think sex is not as much of the priority, although pleasure is. I would
Yeah.
like for you to find your way back to pleasure. And I would like for you to be able to start even small ways of bringing pleasure back into your life, into the way
Mhm.
that you bring pleasure through all of your senses
Yeah.
and experience pleasure every day. But I'm also want you to hold space for your own self-forgiveness, for your
Yeah.
own journey, and to know that it is possible to get to the other side of this, but this is a
Mhm.
place where you feel like you might need some support. You may need a
Yeah.
therapist to walk you through this journey.
Yeah, and I have to touch on something that you said, because I think it's so important, and people may hate this. A lot of times it doesn't, it's not received well, but the person who's been cheated on, they do have to look at themselves too, of what my responsibility can they own into how this played out. Because sure, there's times where someone's just doing it, somebody not in the marriage or relationship for who knows what reason. Other times it's they're fed up about X, Y, or Z that hasn't been talked about. Okay, well, if this need's not getting met, let me start taking, stepping out on somewhere else. Or if we look at that anxious attached person who is constantly accusing their person of cheating on them when that's not actually happening. I just met with someone today who said, like, well, if she's going to keep telling me that I'm cheating, I might as well go out and do it then, since that's what you think about me. So really
Mm,
keen into, we can do all of this work, but if you're still going to behave and operate the same way,
that's not gonna work.
it's not going to work.
It's really not gonna work, you
Yeah.
know?
Yeah.
Oh, thank you so much for that. This takes us to our pleasure practice. As we're getting ready to close, do you think that there's just a tip of anything that you would like to share, just as
Yeah.
a takeaway, something tangible, something that our listeners can really grab onto today that they can try in their relationship?
Yeah. Well, first I have to shameless plug for myself. I have just the tip cards on my website. I am drpia.com. Yeah, and I think it can be a fun way to explore having some of these conversations that maybe we've never had before, or maybe a little like nervous to ask. It's me asking you to ask this person, so it's you don't have to put it on yourself.
That's
So
right.
shameless plug, go get the cards.
Not shameless at all. Helpful plug. Thanks.
Yes, yes, go get the cards. The other thing is, I would encourage people to do I got so many different things really quick. I would encourage people to have like a state of the union, if you will, or the state of the relationship check-ins
Yes.
weekly, right? Like, how are we feeling? What are we needing? What's going on? Just having that like scheduled time to connect. I think that's so important. And having some rituals for connection. Like what does it look like at the end of the day? Like, how are we ending our night together? Like, what are meal times looking like? Do we have creating some sort of ritual? And I think part of that can look at how can we name two appreciations that we have for our partner each day, and one maybe like gentle ask, and having that become kind of a routine. I do this with my stepson every day.
Love the
Roses and
gentle
thorns.
ask.
How is
Yes.
school, right? Like, what is your rose and what is your thorn? Sharing with that person, like leading them into your life. So just a few things that you can do on a regular basis to improve intimacy in the relationship.
Absolutely. And I think mine would be if you haven't been intimate in a while and you want to start again, you might be working with a dysregulated nervous system too, especially if
Amen.
if you have experienced trauma, if you
Yes.
feel completely disconnected, or you even felt
Yes.
like in the past your partner has triggered you, a breath work practice is going to really
Yes.
serve you well. It's going to help you learn how to
Mm-hmm.
calm and regulate your own body. You can
Yes.
go on YouTube and there are lots of breath work meditations. I think those are great places to start because everybody has a different vibe. So, what
Yes.
works for some of my clients may not work for you. So, you can go online and there's plenty of practitioners out there with breath work just to help
Yes.
you slow things down a little bit and
Mm-hmm.
regulate your nervous system. The next thing is, I think, two book suggestions. One, Better Sex Through Mindfulness.
Oh, I like
Because
that.
yeah, by Lori Brotto is very, very, it's going to help you slow things down and
Mm-hmm.
attune to your own self so you can then be more present and show up with your partner. And I think the last one, a trauma sensitive mindfulness practices for safe and transformative healing by David Treleaven. That's both of them are on Amazon, and you can get that to you very quickly. Um, and with that, thank you, Dr. Pia, for joining us in the Lovers Society. I can't tell you how grateful I am for your wisdom and just everything that you are. You're
Yes.
wonderful, beautiful. You're just amazing. I just enjoy you as a friend and even respect you even more as a clinician.
Oh,
So thank
wow.
you.
Thank you. You're like the best hype woman ever, by the way. Okay. I understand when people come to you. Thank you for all that. No, it's been a pleasure. I really enjoy you. And when we made the connection, and we were like, we go together.
We're
We go
friend we're
together. We're,
friend
we're
friends.
friends. We're friends. So it's been a pleasure being here. And I'm so proud of you for the Lover Society. Yes.
Thank
Everybody like,
you.
subscribe, all the things.
Thank you. And where can people find you?
Yes. My website, iamdrpia.com, or on Instagram at iamdrpia.
So excited. Thank you so much for joining me.
Thank
And
you for
for
having
all of
me.
you lovers out there, see you next time.